Imagine this: every single breath you take feels like a gift. But what if your lungs were silently crying for help? Lung cancer often whispers before it shouts, making early detection the key to survival. Stick around, because today I'll uncover 12 critical symptoms of lung cancer that everyone needs to know. Your health, and the health of your loved ones, could depend on this knowledge. Number 1. Persistent cough. A cough that lingers beyond a typical time frame, often lasting more than 3 weeks, can be a critical signal. It may start subtly but gradually evolve, becoming more frequent or producing mucus. Unlike a seasonal cold or an allergy-related tickle, this cough might feel deeper, rooted in the chest, and resist common remedies. Over time, it might disrupt sleep or daily activities, signaling a deeper issue within the lungs. Always take note if the cough accompanies other symptoms like hoarseness or fatigue, as these could compound its significance in indicating lung-related problems. Number 2. Shortness of breath. Experiencing difficulty catching your breath during routine activities, such as climbing stairs or walking short distances, can be alarming. This symptom often develops gradually, making it easy to dismiss as a sign of aging or low fitness levels. However, it may indicate that the lungs are struggling to function optimally, possibly due to a blockage or fluid buildup caused by cancer. Over time, you might notice a sense of tightness in the chest or the need to take deeper breaths to feel oxygenated. Any unexplained changes in your breathing patterns warrant prompt medical evaluation. Number 3. Chest pain. A sharp or persistent ache in the chest can signal underlying lung issues, especially if it intensifies during activities like coughing, laughing, or deep breathing. This discomfort may radiate to nearby areas such as the shoulders or back, making it challenging to pinpoint the source. Often overlooked as a sign of muscle strain or heart-related issues, chest pain linked to lung cancer is typically localized and recurring. It's crucial to pay attention to any unusual sensations that do not subside or progressively worsen, as these could indicate pressure from a tumor or inflammation in the lungs. Number 4. Wheezing. Wheezing, a high-pitched whistling sound when breathing, can often indicate a blockage or narrowing in the airways. While commonly linked to conditions like asthma or allergies, persistent wheezing might be a sign of something more serious, such as a tumor compressing or obstructing the air passages. Unlike occasional wheezing caused by minor respiratory irritants, this symptom does not resolve with standard treatments like inhalers. Monitoring any ongoing respiratory changes, especially if accompanied by other symptoms, can provide early clues to underlying lung health concerns that need medical attention. Number 5. Hoarseness. Hoarseness, characterized by a raspy or strained voice, can occur when the vocal cords are irritated or inflamed. In cases of lung cancer, this symptom may develop if a tumor presses on or damages the nerves controlling the vocal cords, such as the recurrent laryngeal nerve. Unlike temporary voice changes from a cold or overuse, hoarseness related to lung cancer tends to persist or worsen over time. This symptom often arises alongside other respiratory issues, making it essential to seek medical evaluation if it continues without an obvious explanation, especially in combination with other warning signs. Number 6. Blood in cough, hemoptysis. Coughing up blood, even in small amounts, can be an alarming symptom often associated with lung conditions, including lung cancer. This occurs when the tumor causes damage to the blood vessels in the airways, leading to bleeding. The blood might appear bright red or as streaks mixed with mucus, and its presence should not be ignored. Hemoptysis can also result from infections or other lung diseases, but when linked to cancer, it may be accompanied by other symptoms like persistent coughing or shortness of breath. Immediate medical attention is critical to determine the underlying cause and initiate proper treatment. Number 7. Recurrent infections. Frequent bouts of respiratory infections, such as bronchitis or pneumonia, may signal an underlying lung issue, including lung cancer. Tumors in the lungs can partially block the airways, making it easier for bacteria and viruses to thrive and cause repeated infections. These infections might seem resistant to standard treatments, or keep returning after brief improvements. In some cases, the affected area of the lung doesn't clear up entirely, leading to chronic inflammation. If you notice persistent respiratory problems that don't resolve with typical medical care, it's crucial to consult a healthcare professional to rule out serious conditions. Number 8. Fatigue. Fatigue associated with lung cancer goes beyond ordinary tiredness. It can feel overwhelming and unrelenting. This extreme exhaustion is often due to the body's immune response as it works overtime to fight cancer, draining energy reserves. Additionally, cancer cells can release substances that interfere with normal cell function, contributing to this profound weariness. Fatigue may persist even after adequate rest and sleep, and it can worsen over time, impacting daily activities. If you find that this type of fatigue accompanies other symptoms, it's worth discussing with a healthcare provider to explore the underlying cause. Number 9. Unexplained weight loss. When lung cancer develops, it can trigger metabolic changes in the body, causing an unexpected drop in weight even if your diet and activity levels remain unchanged. This weight loss is often referred to as cancer cachexia, and results from the cancer cells consuming a disproportionate amount of nutrients to fuel their growth. Moreover, the body's immune response to the tumor can release inflammatory chemicals that alter how your body uses energy, contributing to the sudden weight loss. If you notice significant weight loss without effort, it's a signal to investigate further, as it could be an early indicator of underlying illness. Number 10. Bone pain. As lung cancer advances, it can spread, metastasize, to other parts of the body, including the bones. When this happens, individuals may experience persistent pain in areas such as the back, hips, or ribs, often described as aching or throbbing. This type of pain typically worsens over time and might become more pronounced at night or with physical activity. Bone pain due to lung cancer occurs because the cancer cells invade and weaken bone tissue, making it more susceptible to fractures. If you experience unexplained bone pain, especially in areas that don't seem to heal or improve with rest, it's important to seek medical attention as it could indicate that cancer has spread beyond the lungs. Number 11. Swelling in the face and neck. Swelling in the face and neck can occur when a lung tumor obstructs the superior vena cava, a large vein responsible for draining blood from the upper body. This condition, known as superior vena cava syndrome, results in a buildup of blood, leading to visible swelling in areas like the face, neck, and upper chest. The swelling is often accompanied by a sensation of tightness or discomfort. In some cases, it can cause difficulty swallowing or breathing. If this swelling appears suddenly or worsens, it may be a sign that lung cancer is affecting the circulation and requires immediate medical evaluation to determine the cause and initiate appropriate treatment. Number 12. Nail clubbing. Nail clubbing, a condition characterized by the rounding and thickening of the fingertips and nails, can be a subtle yet significant symptom of lung cancer. This occurs when there is a lack of oxygen in the blood, often due to a respiratory issue like lung cancer. The tips of the fingers may appear swollen, and the nails may curve downward, creating a drumstick shape. The condition is thought to develop over time as the body tries to compensate for reduced oxygen levels. While nail clubbing can be linked to various health problems, its appearance alongside other lung cancer symptoms should not be overlooked. If noticed, it is crucial to seek medical advice for further investigation and early detection. In conclusion, lung cancer is often silent, with symptoms that mimic less severe conditions. But recognizing these signs early can make a life-saving difference. From persistent coughs to unexplained weight loss, these 12 symptoms are your body's way of asking for help. If you or someone you know is experiencing any of these, don't ignore them. Early diagnosis and treatment could save a life. Your health is your greatest wealth. Share this video with friends and family. It might save someone's life. Don't forget to like, subscribe, and turn on notifications for more life-changing health tips. Until next time, take care of yourself and breathe easy.